And welcome back, fellow American patriots and Minutemen standing at the ready to fight anew for the issues that matter on this Thursday, March 26th. And your host, Daniel Horowitz, back in the house here at Blaze TV. So much to focus on, so many issues. My gosh, there's so much in our AI stack in Congress, but none of that's going to go anywhere. Nothing good. I want to take a step back today and talk about healthcare. March 23rd, 2010. Okay, that was the date that Obamacare was passed. We just marked the grim 16th anniversary of it. And I want to spend today focusing on looking back on what it did and where we are in terms of healthcare. That marked the death of healthcare in America, endless debt, destroyed the doctor-patient relationship, made it that no American can live with dignity without being dependent upon government or a job employer plan that increasingly is unaffordable, decreasing life expectancy, created a monopoly of providers where you have health systems that own everything now, and the death of private practice, the monopoly of health insurers, where there's only a few of them and they now control you because government gave them a market share where they don't need to compete for your business. And that's where you have all these denials and everything. And of course, Medicaid nation, where 75 million people are on something that is for free, giving the administrators of those programs, again, the same insurance companies, the market share that they already need so they can turn around and screw you. So you now have to pay 20 times more than a Medicaid patient. And you know what? Democrats were willing to lose power to pass that bill because they actually believe in something, and they achieved it. They knew what it would do, and they got permanent dependency, and they destroyed healthcare. And this is not just some nerdy issue about healthcare. This is the palladium of every economic issue, and then that ties into culture and it ties into national security. Because it's not just the fact that healthcare is the most expensive item for every American family if you're not getting subsidized by the government. It's that because of the subsidies as well, it is also the most expensive portion of inflation. So it's causing, Obamacare caused an unsustainable spike in the most expensive part of the economy and destroyed that part of the economy, but it's also responsible for the general inflation because it's the biggest driver of the debt, which is the biggest driver of the money printing that's causing the inflation. So you really can't get around this issue. And I want to give a vision on healthcare today. We're going to have Twila Brase on, one of our old friends, to sort of do a retrospective on how we got here and where we need to get the vision that Republicans don't have. But, you know, as you look forward, okay, just to deviate a little bit before we bring on Twila, you look at the priorities of the Trump administration, the GOP, con Inc. media, and you see nothing on repealing Obamacare, a vision on healthcare, nothing on inflation, nothing on a moratorium on foreign workers, foreign students, Muslim immigration, judicial supremacism and jurisdiction stripping, as we talked about yesterday. Nothing about every other issue that matters fiscally, culturally, security-wise, anarcho-tyranny. It's all data centers, AI generative slop, or generative AI slop, FISA 702 reauthorization. There's now a rush to do that. Elizabeth Warren's communist housing bill, Section 8 bill, and then just like an endless foreign policy focus. Oh, and by the way, leave no rhino behind in every single primary with a Trump endorsement, now not just federal, but every state position as well. But all we have to do is pass the SAVE Act and save female sports. Now, not that I oppose the SAVE Act, but you understand that relative to all the issues that you're not doing that are much bigger in my view, including related to the Democrats' electoral power, and then juxtaposed to the issues you are focused on, this is an utter disaster. truly utter disaster. I mean, I don't know if you guys saw yesterday all the news. You had Melania Trump walk out with this robot in this dystopian hell with her thick accent talking about humanoids are going to go and replace teachers to teach children. I mean, I've always said I'm all for robotics over LLMs, but now they want to use robots for the chat slop to supplant humans, which they never could. There's a chemical relationship between humans straight up. It's just like, I'm not against Zoom or Skype or teleconferencing. It's needed. It has its use, but we all recognize that you don't want to, gaslight the civilization into replacing human interaction with Zoom as they tried to do during COVID. I thought we all recognized that. It's so funny how this generative AI data center chat slop David Sachs Zuckerberg agenda is literally the outgrowth of this digital dystopia from COVID. And somehow we're being told that we're backwards leftist if we don't join with what all of our colleagues 3 seconds ago panned under Biden. And if Biden or a Democrat would be president doing stuff like Melania, like, can you imagine if Jill Biden had done that? What my colleagues would be saying. They don't give a damn. It's all good now. And then he announced he's appointing Zuckerberg and Larry Ellison and Jensen to this Council of Science to dictate AI policy when they are the ones benefiting from it. So, of course, they're going to steer the capital, the subsidies, the regulatory structure, the governmental messaging, and the land favors to the modality of the CapEx that they are invested in, even though a free market would not sustain that because it's a bubble, because it doesn't have the ROI. It has the most harms to humanity, but also just, neighborhoods, land, farming, water, power, and it produces the least. And it importantly misallocates it away from edge computing and narrow, low latency AI, which is what we need, which is what China's actually doing and beating us on. That's the sort of thing. So I want to get into that hopefully tomorrow, but this is why you have to follow me at RM Conservative on Twitter, my Substack as well. I try to gather all of the technocracy stories, among other issues, elections, economy, state issues. There's so much going on. I just don't have time to get to, but I want to really focus on healthcare today. And obviously Obamacare, where we go from here 16 years later. Just first, I want to plug a show we have. If you remember last year, we started this Fauci cover-up, and this ties into this transhumanism, Fauci cover-up documentaries we have at the Blaze. We're now coming out with our next installment of the cover-up. It's episode 6. It's going to be the final chapter where it all sort of comes together. Here's what makes it worth your time. You can actually watch the first 5 episodes along with the 6th for free right now. Just download Blaze TV Plus app and catch up before jumping into the finale, because you can't really appreciate it. No subscription needed to get started. But if you get into them and you want more, well, you can head over to FauciCoverup.com/Daniel and use code LabLeak for $40 off the full subscription, which is a massive percentage. So I heard they also unlock some other exclusive Blaze TV content for a limited time. So you're going to want to get into that to get all of my written content as well. FauciCoverup.com/Daniel, and then promo code LabLeak for $40 off. So as I'm waiting for my guest to join me and reminisce and commemorate this really grim anniversary this week, 16 years since Obamacare, I just want to illustrate a personal story or give over a personal story that illustrates the sort of messaging that we could deploy on healthcare, particularly to win back white suburban voters that traditionally veer towards Republicans that have now veered away or are independent or upset with both parties, which, by the way, there's a lot of people like that. The default is they're going to vote for the party out of power. They did that with Trump in 2024. They're going to do that with the Democrats now. But if we had a new movement, preferably a new party, but certainly a new branding, that made healthcare freedom a priority. So it's not just the Maha stuff and the medical freedom on vaccines and dealing with toxins, and that's true, but also the monopolization of the delivery and deployment and the way we pay for it, which actually is the antecedent to the problems of monopolies, regulatory capture, and then bad health care decisions that flow from that. We could completely crush the left on this. They are the ones with Obamacare that created everything people hate with the insurance monopoly and all this stuff. So, and then also just to juxtapose this to Medicaid, which is disgusting what they're doing. People think Medicaid doesn't affect you if you're not on it. But here's the reality. When you take endless printed money, okay? So first of all, the printed money of what is it, 600 billion a year for Medicaid, billion. That in itself creates inflation and it creates high costs for everything you're paying for. It's because of Medicaid Nation and the adjacent programs. But it's more than that. When government uses that unlimited spigot to give to insurance companies to administer the managed care for Medicaid and make it that people have zero skin in the game, by and large in most states you pay zero. No, it's not like, okay, look, you're indigent, we'll have a safety net. You don't have to pay more than X amount for a premium or more than X amount out of pocket per year. No, you pay zero premium, zero deductible, zero even copay. Most of the time, for most things in most states, Medicaid recipients they don't even have the $20, $40 copay, which we would die to be limited to that. We would love that. Okay? So then they get to just overutilize the hell out of it, knowing government's going to give them the money. So then now those same companies, because remember, there's no private and public. It's all one big government managed venture socialist plan. Obama created a monopoly of basically kind of like the airlines, 5, 6 insurers that administer both. Some of them have the majority, some of them have a super majority of their revenue coming from government programs. There's nothing free market about that. It's pathetic. Utterly pathetic. So they turn around and now they don't have to earn your satisfaction. Now they could turn around and screw you, and knowing that government gave them a monopoly, government also gave them guaranteed critical mass of revenue that they need to operate. So now for the gravy on top, they could turn around and charge insane premiums, deductibles, and cover nothing and deny everything. And where are you going to go? That's essentially where we are now. So just to illustrate this, my wife was in the kitchen, and like a lot of women have this, and she sliced her pinky finger and it might have severed a nerve too, but the main thing was a tendon. So it really would have permanently, right now she can't move it properly. So she had to have a surgery, somewhat of emergency surgery. Now, for my employer, we have what is considered post-Obamacare, a very good plan. It's somewhere between the equivalent in the medals of the private Obamacare plan, personal individual plans, between gold and platinum. Okay? So they're spending like $40,000 a year. $40,000 a year. And that's coming out of my salary because I would get that in salary. And then I spend another, let's say, $4,000 or $5,000 from my paycheck. So, that could be like $45,000. Now, look, I am all for, we need to get to catastrophic like it was before, and you pay the rest out of pocket, and then everything would be lower because they can't charge more because government doesn't make the money available. But instead, but if we're going to have a Cadillac plan, then you better believe I want things covered. So, it's not a chronic illness when you have something like you sever a tendon that was an emergency. So that's something you'd want covered. So meanwhile, despite the fact that it officially is a lower deductible, but it doesn't matter. It's not covered. It goes towards that out of pocket, but we had to shell out $3,000 for the surgery. Okay, because there's a coinsurance. And even though it sounds great because 80% covered, but just the 20% because most people get it subsidized. So they could charge an exorbitant amount. Oh, well, even 20%, that's $3,000. Boom. Okay, fine, but we paid it. But again, this is after spending $45,000 worth that I would get in income on the premium. And I know a lot of you have the same story. That's why I'm giving this over. So then she needs OT. And I don't mean to put people down, but sometimes you have these chronic illness or people that have these chronic things. And it's does OT really work or is it just kind of a cottage industry? But this is more like PT. It is absolutely indispensable. Otherwise, you will not get the function of your finger back. This is restorative after surgery. So, mind you, we're paying $40 for every copay for every, but fine, that's fine. Okay, 45,000 premium, 3,000 surgery, copay. Okay. Then they say now they're capping it. No, we're not going to cover any more. That's enough. When it's clearly not. So we'll have to pay who knows how much more. Now, again, if we were paying a pre-Obamacare, what I used to have, we spent for a family, I think I had a catastrophic plan for like 4,000 rather than 45,000. So then, okay, on a bad year, you'll shell out more if something happens, and then you'll have an eventual, total cap. By the way, so here's the thing about the other OT visits. They're not subject to the out-of-pocket cap. You might think, oh, well, between the surgery, we would have met the limit for that year. But no, that's exempt from it. And meanwhile, it's never, we couldn't find that in the plan. But I know you guys could give me endless stories, and feel free to email me, danielhorowitz@startmail.com, if you've experienced this as well. But here's where the rubber meets the road. So many Americans are experiencing this, and Obamacare started with the individual plans, but now the corporate plans are like this too. They have to have a really slimmed down thing and you get nothing for a pretty expensive premium, or you have an insanely expensive premium, get a little bit more, but there's still a lot that you have to pay. And meanwhile, the Medicaid recipients for something like this would pay zero. Now, you guys know I'm not a wealthy person. Okay, by now you know that. You know the metrics on my show. It is what it is. I'm not in the algorithms. So, let's say to be generous, I'm earning twice as much as a Medicaid recipient. Now, it depends what level. Some of them I'm not earning nearly as much, especially the ones at the higher level of Medicaid. But let's just say I'm earning twice as much. But I'm paying about 20 times as much per year than a Medicaid recipient is on healthcare. This is something that you could take to middle income voters, suburban voters overnight. And this is the messaging with Medicaid that is so unfair. And if you ultimately didn't have it and you didn't have any of this garbage, if the money ain't there, the provider can't charge it. But government makes it available. So then you're screwed. That's right. Like those of you who are on Medicaid don't feel bad. There's nothing you can do. They've made it unaffordable. That's what it is. But most people, there are some people that are culturally depraved in this country and some of the Democrat base, but most people would rather a paycheck, not a welfare check, and they'd rather an economy that's natural and free market, and they could afford and shop around, and that's what we need. So anyway, that is the legacy of Obamacare, and that is what the GOP has criminally failed to message. Again, we should be owning this issue, but I want to, we're already far into this. I want to give some time for our guest. So folks, one of the things that really, really rips my soul apart is that every poll of the policy issues by party shows Democrats crushing it on healthcare, especially now. But this has been going on really since the passage of Obamacare, when obviously during the Tea Party era, we were crushing them. We were winning elections. And although I don't consider myself a Republican anymore, I'm an independent conservative, but it is what it is. But the point is, we should be, as conservatives, owning this issue. of medical freedom, of patient-doctor relationship, of getting rid of government-created venture socialist monopolies that degrade healthcare, diminish life expectancy, and yet, we spend 4.5 trillion a year and get nothing for it. Again, it's not just that it's responsible for making the average family now pay 35,000 a year. Again, if you don't think you're paying it, it is coming out of your paycheck, whether you know it or not. It's responsible for you paying everything else because it's the biggest driver of debt, aka inflation. We should be owning this issue. Yet here we are, 16 years after Obamacare. There is no vision. We're into Trump's second term. And if anything, I'm actually seeing less being done on this front than the first term. They were starting with certain things in the first term. Then Biden got in there. And now it's again, it's AI, it's data centers, it's FISA Section 702. It's a lot of bad stuff. It's a lot of distractions. You cannot avoid healthcare. We will not be a free people. This is life, liberty, and property all in one more than any other issue. You just can't avoid it. And yet, here we are on the biggest issue of our time. I'll never forget, Sean Hannity used to have me on during the Obamacare era, and he'd say, the foremost policy expert on healthcare. And my wife would laugh. Yeah, I guess relative to the other algorithmic slop losers in the fake conservative movement, maybe I know more about it, but I'm not an expert. This is the problem. We need Chronicles 1232. People who know the signs of the times and know what ought to be done. And instead, on the biggest issues of our time, we don't have this. We have nothing but algorithmic slop. So that's why sometimes I got to go back to people who predated this algorithmic slop, like our next guest, Twila Brase, who has been fighting for decades for medical freedom before that term was even popularized, giving a vision on what healthcare ought to look like in terms of its delivery, in terms of its pay for mechanism, in terms of privacy. Okay, she's a big leader on Real ID, HIPAA, things like that. What should medicine look like, and why doesn't it look like that? So Twila is back with us. It's been quite a while. She's president of Citizens Council for Health Freedom. Check them out. Tremendous resource, great information on health policy. Twila, it's been way too long. I feel bad bringing you on to mark such a grim anniversary, but good to see you nonetheless.
Well, we have to remember grim anniversaries because that's the only way we can get rid of the grimness in the future.
No, exactly. And I think it's important to recognize that it didn't have to be this way. So could you give us, maybe a 5-minute overview or so of 16 years later in terms of cost, quality, monopolization, death of individual private practice, centralization? I always like to say COVID was the bastard child of Obamacare because we only could have had such terrible response to it, blocking good treatments, pushing bad things, if we had this centralized destruction of independent thinking doctors.
Well, there are so many things that happen that I don't think that the average person out there even understands. They don't understand what Obamacare was, but I think some important things to talk about is what they said versus what we got. But let me just start with the fact that it was a 2,700-page bill that Nancy Pelosi said we have to pass it so we can find out what's in it. Let's just not forget that, because over the last 16 years, the American people have been finding out what's in it. You and I may have known what was in it from the get-go, but the American people just tended to believe whatever was coming out of the mouths of politicians. Whether the politicians liked it or didn't like it, I don't believe they were telling the entire truth, and certainly not those who were in power at the time, President Obama and the Democrats. And so remember how if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. None of that was ever in the works. Obamacare was meant to centralize everything, to take the physician out of the control seat of healthcare, to get rid of affordable catastrophic major medical insurance, to totally get rid of privacy. A lot of people don't understand, although I wrote about it in my book, Big Brother in the Exam Room. They don't understand that one of the first things that President Obama and company did was to put in a mandate for electronic health records so that all data could be digitized and all data could be used to control the doctors, to profile the patients, to ration the care. They don't understand that it was the foundation of Obamacare. If they hadn't nationalized data, they couldn't nationalize healthcare. The other thing people probably don't remember is Senator Max Baucus, head of the Finance Committee, walking out after the decision and saying something to this order: "At last, we've corrected the maldistribution of income in this country." Well, did they ever tell anybody that before they passed the bill, that that was their idea, to correct the income maldistribution in this country, that their entire plan was to redistribute wages, to redistribute wealth, and to use the Affordable Care Act to do it? So I know you told me that even though I wasn't on, you were talking about your $45,000 that you are essentially being forced to give to the system, and it promises you nothing back. So this is the redistribution of wealth in this country. And what other people don't.
By the way, Twila, I had a Blue Cross catastrophic plan. Family. I have a family of 4 kids, wife, 4 kids. It was about $4,500 a year. That was, if you like your plan, you could keep it. And for $45,000, it doesn't pay that much more. And again, I say $45,000 because a lot of people, and I think Republicans have done a bad job of this, when your employer gives you a plan, he didn't give you a plan. It's not just the amount you pay out of the withholding, but the amount that they're paying you would have gotten in salary. I've been told I would have gotten a raise. They're paying up to their noses in it. So it is coming out of you. But anyway, go on.
Well, I do want to go on, but I do want to comment first, because I'm going to talk about what Bloomberg said, so I don't want to forget that. But I do want to say that this is a theft. So employer-sponsored coverage is actually a theft, and people think of it as a benefit. It's not. And because of the Affordable Care Act mandating that everybody only have access to a so-called qualified health plan, which is just the corporate version of socialized medicine, those health plans go to the employer and say, well, this is what I'm offering you. There's really no negotiation here. Remember when there was 10 different types of insurances to pick from? No, there isn't that. And that's why this is a theft. It's monopolization, and it is exploitation of the worker through the employer by the health plan with the blessing of the government. So people need to understand that it is really important actually for all of us to move away from employer-sponsored coverage and get back to individual ownership of affordable catastrophic policies for $4,500 a year. I think everybody would find that pretty affordable, and those who couldn't would find doctors who were taking cash from everybody. They'd find doctors and hospitals more than willing to be charitable towards them.
Sure. And I want to get to your solution. You're obviously cash, catastrophic, charity, the 3 C's. But so we talk about cost. There's also the monopolization of, so not just the insurance, where it's just a handful of them, like the airlines now, post Obamacare, but also on the providing side that we saw right after the passage of Obamacare, this trend of you no longer go to Johnny Cash's OBGYN or, cardiology office. It's all MedStar this, LifeBridge this, the consolidations, mergers, acquisitions. And then I'll just give a stat and have you comment on it. So in 2012, right as the implementation was beginning, 25.8% of doctors worked for health systems, hospitals, health systems. As of 2 years ago, 2024, it was up to 77.6%.
Yes. So let's just talk about that. So I just want to give the Bloomberg statistic first, which is that after Obamacare passed, Bloomberg government had a paper, which is very hard to find. It may not even be online anymore, but it talked about the fact that this was a $1 trillion windfall for the health plans over just the first 10 years. So Bloomberg government saw that this was a complete consolidation and a complete, not takeover, because it was given over. It was given over by Congress to all of these health plans to control everything. And then that caused, of course, the consolidation that you're talking about. But so did another piece of the Affordable Care Act. The Affordable Care Act has something called the Shared Savings Program. And the Shared Savings Program means that if a hospital saves the government money, it will the hospital will share in the savings. In order to be part of this share, in other words, this is a kickback program. And it's so much of a kickback program that they wrote a regulation exempting this program from the anti-kickback statutes. So, I mean, it's just kind of amazing, right? But in order to participate in this, the hospitals have to become part of a ACO, an accountable care organization. Now, ACOs have been called HMOs on steroids. So if you think that HMOs are, have networks and are regulating when you can and cannot go to the doctor and who you can go to and that sort of thing, well, the ACOs are just as bad, if not worse. So in essence, in order to save money for the government and to get the kickback, what does a hospital have to do? They have to try to commandeer all resources and all providers under their umbrella. And that's how I look at an ACO. I look at it as an umbrella. So they started by contracting with physician groups, and then they decided, well, let's just buy them, right? And so all of these physicians being purchased by the hospitals, and even some of the health plans are buying hospitals and healthcare systems are buying health plans.
Yep.
And there's all this consolidation, but there's a kickback here. So if the hospital can control all the care that's given in the hospital, can control all the doctors, Medicare puts Medicare recipients into these ACOs without their consent. And then they've got this like cluster of people attached to the hospital. And if they can control all the costs for this cluster of people by controlling the doctors, owning the doctors, employing the doctors, contracting with the doctors, and keeping those doctors out of their hospitals and using hospitalists only, except for specialists, they can control the cost. They can limit the care. They can have cheaper hip implants rather than the ones that'll last you longer. They can do whatever they want to control the cost of care in order to get a kickback from the government.
Sort of like the building codes that you have nowadays and the construction quality cutting costs. But again, I've always said a principle that conservatives should have pushed emphatically is that programs meant to deal with the indigent or seniors should never be used as a tool to create artificial corporate monopolies that the market would have never set. So the other big story looking back retrospectively is the Medicaid program. Basically, despite all this talk about, so we had to arson the entire healthcare and health and medical insurance industry in order to so-called cover people who needed it. But then 75 to 80% of them anyway, we just dumped on Medicaid. So now you have like 75 million on it at a cost of over $500 billion a year. And I mentioned before, I want to get your take on this. What I find fundamentally unfair that I think, again, Republicans are pathetic and fail to give this over is, so, my wife had the surgery. Now she needs OT to get the function back. And most Medicaid recipients in most states do not pay a dime for anything. So what happens is government uses its endless spigot to give the managed care plans critical share of money that they don't need to compete. So now they could turn around to us, and I don't have exact numbers, but let's say I make twice the amount that a Medicaid recipient does. At the higher end of the Medicaid scale, I clearly don't make twice the amount, but let's just say twice. But I'm paying about 20 times more than a Medicaid recipient. What do we do with this problem that we now have 16 years later? 75 million people dumped on this as the only care that they have.
I know we're going to talk about the 3C solution, so I'm going to leave that. For the moment. But I do want to say I am a registered nurse. I have taken care of lots of Medicaid patients, both in the emergency room where I was a pediatric emergency room nurse and in the school system. So I have dealt with the Medicaid population. And I know who comes into the ER. I know and I remember the Medicaid patients who came in for something really negligible. And the first place that they headed was the vending machines, where the entire family came back with this goodie and that goodie. And then, we saw them and they went out scot-free. But what if they had to pay even that amount of money that they had paid to the vending machines to get into that emergency room, right? And so
Yep.
you know that people with Medicaid have money. And here in the state of Minnesota, we're a national organization, but here in the state of Minnesota where we're located, they at one point had like $3 for an ER visit or $2 for a doctor's visit. And when the Democrats got in charge, that whole thing went away because they don't want them to have to pay a thing. But here's the deal. Here's something that Minnesota has posed, which I think is really interesting. And it might actually be a fine idea. Now, the Democrats here are opposing it because they want socialized medicine. But it's not a bad idea if you're going to accept keeping the Medicaid system, which I don't think that we have to do.
Of course. But yeah.
Okay, but let's just say we have to keep it. So I had lots of Medicaid patients in the school system where I would tell and they're like, they get a laceration, right? And I tell the parent, come on in and get your child. And the child would come back without ever having that laceration stitched. Now, the parent wasn't working. The parent wasn't on drugs that I knew of, but they just decided that this laceration was no big deal. And so they didn't have to pay a snit for it. But they did not go in and get it done. Now, just imagine if all we did was pay for the people who really needed care, and the state paid it, not a health plan. So Minnesota actually has a study that the Democrats put in place to see what it would cost for the state to resume control of the Medicaid program. In other words, to be the ones that pay the bill. So they wouldn't be paying per member per month, no matter whether a Medicaid patient ever went in. They would only pay for when care was rendered. This is not a bad idea to go back to because, for one, you get to find out exactly how much the state is paying for Medicaid. How much care is actually being provided. So I think that this has some merit, and I think other states should consider it and should get health plans out of this business. They want to decrease their cost to the state, but they've actually increased their cost to the state by giving all this money to the health plans.
This was the problem with Nixon with the HMO Act. The understanding was, let the private sector deal with it. They'll deal with it more efficiently. Now, in a vacuum, that might be true, except there's one problem. That the government has an endless spigot of inflationary printed money, and they and their lobbyists know that, so they'll constantly bilk it, so you get the opposite result. Whereas if we merely had a free market for most of the country, where you pay out of cash, if the money ain't there and the government doesn't pony it up, they can't charge it. This is the rule of supply and demand. The provider cannot charge more than what you could afford. This is why with housing right now, the market's frozen now because sellers are obsessed with that Z estimate, but they're going to have to go down on that. And buyers are like, we don't have the money. So that's it. But if government comes and makes it available, then you're screwed and you need it. So then you just take the small population that can't afford it and you give them the money to purchase a catastrophic plan. And you could even have an HSA that you pay for out of pocket. And it would be a fraction of the 4.5 trillion that we spend as a nation on healthcare, over 2 trillion worth in terms of government funding for those for government funded programs. But I do think we do need some cost sharing because most of the Medicaid recipients, like you said, we're not saying they're wealthy or even treading water, but they do have smartphones. They get a flat tire on their SUVs. And yes, they'll often have SUVs, not compact cars. You'll shell out $200. But the notion that my wife has to pay, after having a $45,000 plan, $3,000 for a surgery, $40 for every copay OT visit, which I'm fine for if that's it. Oh, but now it's capped and you have to pay who knows what, and it doesn't go towards your out-of-pocket limit while you guys are paying zero. I literally don't earn exponentially more than a Medicaid recipient. And I think just politically, it's stupid of Republicans not to appeal to suburban voters that are having to deal with this that, of course, you want a safety net to the extent you agree with this system, and a backstop so that they're not on the hook for 10,000, 20,000, whatever it is. But a copay? My gosh. That's ridiculous.
So I just have to say that because of the Affordable Care Act, but also because of Medicare, and because the government is basically a single payer or a single controller system of this, even though Medicare recipients are paying money, they are the single controller. So because of these, what we really have is a healthcare system today that is not on mission. The healthcare system today is not on mission. I like to say that the mission of medicine has been taken over by the business of healthcare.
Yeah.
And because it's not on mission, the mission today of the healthcare system is exploitation. It's exploitation of the patient, it's exploitation of the doctor, and it's exploitation of every piece of data that you have that they want to use for their own purposes. It is a system of exploitation. And as much as the doctors and nurses may want to be helping people today, their hands are often tied. Their minds are elsewhere. I just read a study that a system did of their doctors. And they found that their doctors were spending 11 minutes with patients and 37 minutes with the paperwork. Yeah. 11 minutes with patients. This is a very clear sign of the mission versus the business that is going on today.
And that's a forgotten side effect of Obamacare right there. You see it, constantly with the iPads, not even looking at you. That is another legacy. The endless paperwork, the economies of scale to deal with it has also been responsible as another factor in shifting private individual practice to the corporate conglomerates. But also there's one other provision I want to get to with Obamacare that I think is maniacal that Republicans don't go after, because honestly, I do think you would get 60 votes in the Senate to repeal it, is the ban on physician-owned hospitals.
Yeah.
Talk about that.
Yeah, so this was something, and we, even before the Affordable Care Act, this was something happening in Minnesota, with certificate of need. If you even kind of look at the two of those together, right? This idea that people who want to come in and build their own hospital, if they want to build their own clinic, their own radiology facility, it's basically mother may I to the government, and then all the current ones who are there now operating the hospitals, the clinics, the big systems can come in and tell the government, no, we don't need another one of us. No, don't give them a certificate of need. Okay, so that's what was going on before. And then with and it still is going on today. And so it limits the number of places you can go. It limits competition. It keeps the costs high. But then in addition to that, here along comes the Affordable Care Act and saying that physicians cannot own hospitals unless they're willing to accept that not a dime of Medicare and Medicaid will come to anybody in their facility. Now, in our 3C vision, we actually want this to take place, but this is not.
Under the current paradigm, it's impossible.
That's right. That's exactly right.
And that's what needs to change, that Medicare and Medicaid cannot be weaponized as a way of creating monopolies. And this is a message that people really need to hear. Okay, so the 3 C's, where do we go? This is like a 10 alarm fire. It's death by 1,000 cuts. What do you do with a system like this?
So we developed the 3C solution, and we're about to become building it in a major way. But the 3C solution is really to go back to healthcare the way it was meant to be, the way it used to be. And that was cash, catastrophic coverage, and charity. And some of your listeners will blink particularly at the charity. And so I'll tell a story about that will make them calm down about the whole idea about charity if it scares them. And so cash, because cash is control, cash is power, cash is king in the hand of the patient. And who should have the most control? Whose life is at stake in the healthcare system? No one but the patient. Not even the doctor's life is in control. And so when you have the cash, you can talk with your doctor. You can figure out with your doctor, well, what are the prices? Cash makes every price transparent. Cash brings back competition. Cash means that there are no third-party payers, no third-party bureaucracy, no prior authorization, no retroactive utilization review, none of that. It all goes away. Then when you think about and people are thinking, well, yeah, but how about if I have a catastrophe? What if I need a surgery? Well, first of all, the Surgery Center of Oklahoma does all of its surgery for cash. Now you can submit your bill to your insurance company, but they do it all for cash, and it is up to 90% less than at the hospital that would do the very same surgery. And it often includes more services, like maybe 3 or 4 days of PT, all wrapped in there at your home base, or 2 days at a hospital in Oklahoma. At a hotel in Oklahoma City, right? So we can have cash-based surgeries, but the fact of the matter is catastrophic coverage. So today they would say, well, we have catastrophic coverage. No, you don't. Catastrophic coverage is the major medical policies that pay you. And they have actually sort of like, they probably have tables of what they're going to pay for cancer, what they're going to pay for this surgery and that surgery and this surgery and that surgery. And the hospitals and the doctors know what those tables say. But the insurer is not going to pay the hospital or the doctor. The insurer has a contract only with you. It's a two-party contract between you and it. And that means there's only a first payer system in healthcare, and that's the patient. So the health insurer, the real insurer that doesn't get involved in making decisions, doesn't have networks, doesn't do any of that, that insurer pays you the cash, and then you go talk with your doctor and your hospital. And much
more like other forms of insurance.
Absolutely. Much more like the entire market works. And of course, most people have elective or minor or routine. They don't have catastrophic emergent. I mean, even cancer is catastrophic, but you got to make a lot of decisions before you even have your first treatment, right? And you can make those decisions with cash in hand. Maybe you want to go to a cancer treatment, what are they called? Cancer Treatment Centers of America or something like that. And Medicare Advantage doesn't even let you access those, right? Just as a little aside there, right? But when you have cash in your hand, you get to decide where in the country, which doctor, who's best, who do you trust? And you take your cash in hand and you talk about prices, and they'll tell you every price that there is, and you'll make a decision with cash in hand.
So now, before you get to charity, I got to chime in because people are going to ask this. They'll say the industry people like to say, well, Twila, that was all good, in the old days, but now with such sophisticated diagnostic tools and expensive equipment and expensive technology, even outside of people that are indigent, but just the average person won't have enough cash to afford the regular stuff they'll have over the course of their lifetime, even before you get to things like cancers or major surgeries.
So they're just forgetting about markets. Because as soon as you have everything cash, remember the Surgery Center of Oklahoma, 90% less than the hospital up the street, and actually so inexpensive that the state of Oklahoma has told all of their employees, if you go to the Surgery Center of Oklahoma, no copays, no deductibles, no coinsurance. We will take care of the whole thing because it's so inexpensive. So the prices of today will not be the prices of tomorrow. And once you get to a cash economy, everything changes. Every price becomes transparent.
This is what Republicans have failed to implant in people's minds for 15 years. That you have to understand, if you're on Medicaid, of course, we have, let's take Medicare. I'm going to have to be on Medicare. We all will. Because it's there, you need to be on it, because you can't be alone in a market that doesn't exist, because they have market share already, so they can turn around and hose you if you try to pay out of pocket. But if the entire country were in this system and government didn't make the money available to the cartel, if the money ain't there, they can't charge it. You could tell me all you want. Oh, it costs this. You could say all you want, but everyone's like, well, people don't have the money. All the more so if the money's not there, they can't charge it.
Well, they can't charge it, but they'll want to sell their goods, right? So they will make it affordable. And as soon as you get all the regulatory morass and all the third party, convoluted paperwork that everybody has to go through, everything will be less expensive. I remember with the electronic health record mandate, and that was Obama and the Democrats. And I haven't seen the Republicans taking away. So I'm just, they might not have been there. They may not have been the controllers, but they're also not helping. But anyway, when that happened, I was talking to an ENT doctor, and he said, do you know what happened when we had to bring those electronic health records, those government certified ones, not just any ones, but the government certified ones? We had to add seven people to administer the medical record, the electronic medical record. It made it so much more expensive. And then it takes away so much time, right? And it takes away so much of their time and their brain. And now, of course, this is what I actually think, is where this is kind of going. I think the electronic health record was for much more than even just billing. I think this is all about putting the algorithms into the computer, not needing the doctor anymore, putting in non-physicians, PAs and NPs who don't have all the critical thinking, all the expertise and all the experience and all the training of a physician. They won't even necessarily be able to think outside the algorithm because they've never been trained, right? And so then if you have if the computer becomes the controller, according to...
The computer will know more than the greatest doctor.
Not necessarily. They'll know what
that's what they're pushing.
Oh,
you saw the first lady out there with the robot was saying it's going to replace teachers and it's going to teach you. So this is the sort of Larry Ellison, Sam Altman mindset that they're saying. So they're going to take all this and I've told everyone this, LLMs and data centers and cloud are not good to produce weapons of war and narrow, tailored, low latency AI that is useful that China is actually working on. It's good at one thing, and that's a surveillance state. But China's not building them because they already built a surveillance state before that, so they don't need it. And this is where the rubber meets the road. But this is, rather than talking about the CCC, the plan of the Uniparty in Washington now is FISA Section 702 and, more power to the LLMs and subsidizing that. So, when you see Dr. Oz and others, they talk about this stuff and they talk about it in terms of innovation and it's going to have better outcomes. And yet AI is like saying a search engine. It's a tool. It's not good or bad. It's how you deploy it. You can use it for good. Where do you think is more appropriate of a use relative to what they're trying to do?
So there's an article in the paper, I think, or in my feed anyway, this morning talking about how physicians using AI are having a harder time finding the discrepancies in the radiology. Now, I haven't finished reading that article, so I don't know all the things, but even things like that, when you hear things like that, then then you're like, well, who's training the AI? And, the AI needs a constant data feed in it, or it will start to hallucinate, which means it will just make up things. It will just pull things together. And probably you have seen that when you've done, Chat GPT and you've looked at something and thought, well, wait a minute, I know something different than that. And you look at its source and you realize it's pulled something together that doesn't belong together. And so so I was reading some comments by physicians about AI, and this one physician has worked as a physician for 40 years. And he said, he's not as concerned about AI because he's been practicing for 40 years. So he knows what he's doing. He's had lots of experience and expertise. He's a little concerned about what he called de-skilling, so that his skills would come down. But he said the real concern are the new doctors who might be experiencing unskilling. Like they'll never be trained, and they won't even be trained to know whether what they're being told by AI works, is a good thing, is not a good thing, could harm the patient. They won't even know because they won't have had the training.
Know. And that's my biggest concern. It's funny, like it sounds like you're where I am on AI in general, because this is true of every other industry. There's the industry shills that are the venture socialists, and then there's like the doomers that almost are on the opposite side, but they kind of agree with them. Oh my gosh, it's going to be sentient and it's going to do all these things. We got to stop it. I'm like, Well, I'm neither. It's much more limited than that in terms of what it does. If you have it as an adjunct tool, like a search engine, it's a tool. But the problem is when it's being gaslit with government favors and training people to think that it's a destination, not a tool. This artificial general intelligence, AGI, that's where that's a problem, because it's almost like you're fighting a battle and you're like, drop your current weapons, surrender them, and don't worry, I'm going to deliver you something much better. So you lose what you had, and then it fails the promise. That's my concern. It's not that it's replacing humans. I'm fine. We have washing machines that replaced hand washing, and it did a better job doing that. So a lot of people forgot how to hand wash, but it is what it is. There's a lot of things like that. Here it's a little different, that people are surrendering their brain to it.
That's
and then it's not properly replacing if you don't use it with the right right balance and everything. So I think that's an interesting discussion I want to get to more. There's two more things before we finish the hour. We'll have to do a part 2. Charity and auto enrollment in Medicare Advantage. So let's go with the charity. Do you mean a government policy that fosters that? Or are you saying that if we merely cut out the middleman and gave doctors more time, less overhead, and, patient-doctor relationship just with cash, they would naturally want to engage in charity care?
So I know doctors, specialists, orthopedists, others, who would just as soon have charity care, provide care in a charitable manner rather than through Medicaid. Now, I'll tell you 2 stories because I think they emphasize the point. Here's one story. A gentleman giving a presentation alongside me was asked a question about Medicaid. And he said, "Oh, okay, you want to talk about Medicaid? Let me just tell you a story. I spent 45 minutes with a patient, and then he said, I did the paperwork and, to get paid by Medicaid. And several weeks later, the check came in the mail, and I opened up the envelope and I found a check for 32 cents. 32 cents. And he said, I would rather have given that woman charity rather than to be insulted by receiving a check for 32 cents for my time and service. Now, just as a thought-provoking for your audience, right? 32 cents is half the cost of the stamp it took to send him the envelope, right? So that's
this is not back in the day when it was 29 cents.
No, and years ago, the owner of a business told me it cost $25 to send somebody an invoice for them to pay. $25 when you talk about the staff and the mailing and the equipment and all this kind of stuff. $25. So who knows what that price is today, right? So it cost him a lot to send him a 32-cent check. Okay, another story was from an orthopedist who said that he spent 10 hours giving a woman 3 inches more to her height as he corrected her spine, and she was a Minnesota Care patient, which is like the Kid Care, Obamacare for people who make more money than Medicaid, but still low, right? Okay, so he said for reimbursement, 10 hours, gave her 3 inches, brought her back to, working ability, and he got a check for $1,000. Which, of course, he couldn't keep a cent of because he had to pay the PA who helped him alongside in the surgery, as well as the nurse. So, and he was the one who told me that he used to give care for we have a hospital here that is, children with great disabilities. And he used to go for free, and he said there were tears and gifts and cards and hugs and everything. He'd just give it for free, and it was a beautiful thing. And then when this hospital decided to take insurance, all that went away, and so did he. Because he loved being charitable. He loved that relationship. He loved that gratitude. He loved being generous that way. They took it all away.
No, and I got to say, this is part of the Florida Hope Florida model that the rhinos were panning there, where they wanted to try to partner with charitable organizations, religious institutions, to try to get people. There's so much charitable giving in this country, and
Hmm.
doctors are part of that the people forget, that could take care of this. We have a myriad of charities. There's so much bad going on culturally in this country, but that's something that's still a big positive relative to other countries, and we don't harness that enough. It's all about putting people on these programs. So, relatedly to that, one more quick thing I want to get to.
Can I just say one more thing?
Yeah,
I just
sure.
have to say one more thing. So a physician also told me that because of all the paperwork that they have to do in today's healthcare system and all the people that they have to employ because of it, it is very difficult for them to be charitable.
Yes.
It is hard for them to have they want to be charitable, but where are the resources to be it when they're all being taken by bureaucracy and paperwork?
No, exactly. So speaking of that bureaucracy paperwork, so we're lamenting all the things that the Republicans aren't doing, aren't messaging, but I didn't realize there's also some new bad policies taking place. Could you talk to us real briefly, about 2 minutes? What is this auto enrollment and Medicare Advantage mandate?
And I just kind of can't believe it. Here's Dr. Oz, and well, no, it wasn't Dr. Oz. It was the head of Medicare recently in an interview talking about how they are considering auto enrollment. So everybody who goes into Medicare, they're just going to auto enroll them into Medicare Advantage, the health plan version, the rationing version of Medicare. The government has said in 3 reports that Medicare Advantage plans are rationing medically necessary Medicare approved care and forcing seniors into an appeals process. 75% of the time, the appeal is the appeal works and it's overturned, but only 1% of seniors and doctors ever appeal. So it's a very lucrative strategy for them. So here we have the head of Medicare saying, we're considering just auto enrolling everyone. Yeah, they'll be able to opt out, which means it'll take a lot of time, effort, figuring out how to do it. It's a burden on them. So their hope is to get more and more people into Medicare Advantage where their health care can be rationed away. And who has pushed this? The Heritage Foundation had it in their Project 2025. And Paragon, which is another group, which does a lot of great work.
I've had them on
DC.
before.
They too are like, Medicare Advantage, this is a great thing. And auto enrollment, that should not be. And people are paying a lot more money to be in original Medicare, where they have freedom to go to any doctor, any hospital, anywhere.
So Twila, you're getting into a very tough discussion here, because these are some friends of mine. I know Paragon, and I agree with you, by the way. But I think what's so tough about this is why I coined the term venture socialism. There's sometimes venture socialism is worse than pure socialism. I think some people are honestly just trying to figure out what is the best thing to do now when we have an unideal system. So some people view Medicare Advantage as more free market because it has private. But I think after you and I have discussed this for an hour, Obamacare and this new structure has made it that the managed care on net are actually worse than the pure government programs, because you have the greed of the private sector without the check and balance of a free market, because they're ultimately not. This is the venture socialism where government funnels printed money through private entities that are only, most of these companies, they get most of their money through Medicare Advantage, not through any innovation, not through any private program. So I tend to agree with you on that disagreement. I do think some people are just struggling. What do you do? And these are the debates we need to have that I think are productive. But your broad framework is, cash, catastrophic, charity. We need to go to that. If it's not feasible to go to full charity, at least if you keep these programs, they need to be scaled down to those who need them. You need cost sharing, but everyone else should be in one market where you purchase an unlimited number of unregulated plans, what you need, and pay the rest in cash. And then that, 10%, 15% that you want to call it can't afford it, then fine, then you just give them the money directly. Going back to your Medicare Advantage thing, the best way to give a handout is to give a handout. The worst thing you could do is funnel it through venture socialism and the middlemen, then you get the worst of both. Twila, where could people find your work?
They can find us at cchfreedom.org, cchfreedom.org.
Great resource. We didn't even get to HIPAA Real ID. We're going to do that next time. This ties into life, liberty, property, privacy, everything. We got to get healthcare right. Thank you, Twila, for joining us. And thank you all. We'll see you back here, same time, same place tomorrow.